Hi, I'm Terry. I'm one of the nurses at RGAL, and I'm here to talk to you about the GlycoLax Gatorade Bowel Prep. You will have received an instruction sheet from the doctor's office. Everything that I'm talking about today is outlined on this sheet. If your doctor has written a prescription for you for the GlycoLax, you can pick that up at the pharmacy. It can be Miralax or GlycoLax. They are the same product. When you're there, you should also pick up some Dulcolax tablets. You can purchase Dulcolax tablets without a prescription. You will find them in the laxative section of your pharmacy. So while you're at the pharmacy to pick up your bowel prep, you may also want to consider the following items for comfort measures: Tux pads or witch hazel, A&D ointment, and maybe some chamomile tea if you have a little crampiness in your belly throughout the day before you start the actual bowel activity. The day prior to your procedure, you'll be following a modified diet of full and clear liquids. Full liquids are items such as milk, ice cream, yogurt, cream soups, as long as they're not pieces of solid, and Jell-O. And the clear liquids are water, Gatorade, soft drinks, black coffee, tea. We do ask that you avoid items that are red or purple because they have dye in them and can discolor the inside of your colon. Items that should be avoided the day prior to your colonoscopy are things such as the red Hawaiian punch, purple grape juice. You may have white grape juice or white cranberry juice. Soft drinks if you choose, as long as it's not a red or a purple. Tomato soup is allowed, even though it's red, since it does not have an artificial dye. If you are a diabetic, remember that you will not be eating solid foods, so you will want to adjust your modified diet accordingly. The morning prior to your procedure, you will need to mix the GlycoLax in the Gatorade. Typically, we suggest a 64-ounce bottle of Gatorade, but because we need to mix something in this bottle, I'm going to pour a little bit out so I have some room for mixing. If you find that Gatorade is too sweet, you can dilute it with water, or you can purchase the G2 Gatorade. Shake this up until the powder is completely dissolved in the Gatorade. Now we're going to put it into the refrigerator until 6 p.m. At 2 o'clock, you will take 4 of these Dulcolax tablets. If you're not home at 2 o'clock, take the tablets with you. Remember that bowel activity will not begin for at least a couple of hours. You may experience bloating or crampiness prior to the onset of bowel activity, and then once the bowel activity does begin, that should subside. In the meantime, you may want to have a nice warm cup of tea. Just remember, we don't want you to have any of the red or purple. So if you have some fancy red or purple tea, save that for another time. At 6 p.m., we're going to take the Gatorade with the GlycoLax out of the refrigerator and start drinking. Once you've started drinking your bowel prep, then you're only to have clear liquids for the remainder of the day. So before you have started the prep at 6, you should have your last cream of tomato soup, your last milkshake, and then start with the clear liquids. We will drink half the 64-ounce bottle now, and the other half will be consumed 5 hours prior to leaving your home to arrive for your procedure. We'll drink an 8-ounce glass every 15 minutes until we've gotten 4 glasses, or half the bottle. Now that we've drank half the Gatorade, we'll put it back in the refrigerator until tomorrow. You may be in the bathroom for a few hours, but most people do not experience an entire night of running into the bathroom with bowel activity. Before you go to bed, you will want to drink at least 2 8-ounce glasses of a clear liquid. Again, remembering that they should not be red or purple. If you are thirsty and you would like to drink more, drink more. You'll feel better if you're not dehydrated. Five hours prior to leaving your home to arrive at the facility, you will finish the second half. Your time of arrival for your procedure will be listed on this instruction sheet. For example, If you were scheduled to arrive at the facility at 8 a.m. and you were going to leave your home at 7:30 to make it on time, you would get up at 2:30 a.m. to drink the final portion of your bowel prep. As before, we'll drink an 8-ounce glass every 15 minutes. The second dose of bowel prep typically works a little faster than the first dose, so don't be alarmed if you find that you're in the bathroom a little sooner than you were the last time. From that point on, you should not have anything by mouth, exception being any medications that you were instructed to take by your doctor. These medications may be taken no closer than 2 hours to your appointment time with just a sip of water. If you find that you are thirsty, you can rinse your mouth out with water, or you could dilute mouthwash. Mouthwash tends to dry your mouth out, so if you dilute it and rinse, that can help to keep your mouth feeling moist. You should not have any candy, gum, or mints. If you are a diabetic patient, you should not take any of your diabetic medicines the morning of your procedure. If you are on insulin, your doctor will have prescribed special instructions for you to follow. Remember when you arrive to the office that you're going to have your driver with you, and they must remain in the facility throughout the procedure. The entire time is approximately 2 hours. We do provide free Wi-Fi, so if they have some work they want to do or they want to just get on the internet, all they have to do is check with the receptionist and she'll give them the password. Because you are going to be sedated for your procedure, remember, you should not drive, work, or operate equipment that day. The day following, you will be able to resume all of your normal activities. We look forward to seeing you, and don't hesitate to give us a call if you have any questions or concerns. Happy prepping!